Hi, my name is Tracy Truelove, and I'm the Communications Manager for the COVID response here in Pitkin County. Thank you for joining us for what I believe is our 14th community conversation, and we are changing things up a little bit to start today's meeting. We're joined today by Pitkin County Sheriff Joe DeSalvo and Pitkin County Emergency Manager Valerie McDonald. We would be remiss not to start this meeting having a little bit of a public safety conversation with all the activity happening, in our Roaring Fork Valley. So we wanted to just give you kind of a heads up of what's happening, and then I've got a slew of fantastic subject matter experts here today that when they come up on their turn, they're going to introduce who they are and what they're talking about today. But with that said, I'm going to go ahead and kick it over to Sheriff DeSalvo. Joe, thanks for being here.
Thanks, Tracy, and thanks for the opportunity to use this time to address the community about something other than COVID, although it could be COVID-related in some ways. I'd like to start by giving you an update on Independence Pass and some of the decision-making that went behind, or that was behind that process. Yesterday, we did have some issues on Independence Pass with a lot of traffic due to the diversion from I-70 in Glenwood Canyon due to the fire that's currently there. That fire is still burning with zero containment. Still very active area for aircraft, helicopters, and heavy air tankers. That incident is now being managed by a Type 1 incident team, and that's a federal team that basically makes the calls on whether the highway is open or whether the highway remains closed. With that, when the highway was closed yesterday, traffic was diverted to Independence Pass, and there was some broken down trucks that started the initial problem. But I think I'd like to make it clear to the community that, because I do get more than my share of emails today about why don't we just not let trucks over the pass. The problem is volume, if I could make it as clear as possible. CDOT says there could be up to 50,000 cars a day that pass the Copper Mountain exit. Most of them will get off to get to Denver at that point or go back that way to get to other areas. That's a lot of volume for a two-lane, narrow mountain road. Even if it's 20% of that, 10,000 cars a day is an unsustainable amount to come over the pass and to travel through Main Street Aspen without causing major impact on not only our city, but our county, our emergency response. Also, I needed to consider that that fire may be headed our way. I mean, it's right now an unpredictable fire. It's 4,500 acres, and because of the winds and the inability to contain it, I think I would rather have Independence Pass left open or left closed and reopened for emergency egress for Pitkin County if needed. It really is a perfect storm. So I need to reiterate that trucks are not the only problem. It is the sheer volume that is coming over the pass that is just not a mountain road like that. It was clearly not designed for that kind of traffic. I was happy to have the complete support of CDOT and the governor's office in this decision. It's unfortunate that we moved our problem to Steamboat Springs and other smaller communities, but their roads surrounding their communities are much more adequate to handle that kind of traffic. So for now, Independence Pass remains closed. It is open to bicyclists and commercial vendors that will work up there, and what I'm talking about is some backcountry guides, some river rafting, and people with local licenses that live on either side of the closure, meaning if you live in Leadville and you're a stonemason and need to get to Aspen for work, of course you'll be allowed to go, and vice versa. So I think I've covered it, but Tracy, I'm sure you'll let me know if I missed anything.
No, Joe, thanks for that update. And yeah, obviously a conversation that's near and dear to my heart from my time with CDOT. What I will share is that for people who have questions, cotrip.org is the best resource for what CDOT is putting out for information around the road closures. There are clearly a couple of different routes people can take, and they have all that information on that site to help guide that conversation. And we know this is painful when I-70 closes. We see it all the time, and that's what happens about, you know, in these small mountain communities. You're exactly right. So we're just really, it's all about the safety of the community. And I know that's, again, hard to take in this, you know, where we're at right now with COVID. It's been a tough couple months. I can't imagine what else they're going to toss our way, but there's a tremendous amount of updates. I'll share that being where I'm at, we have been closely tied to the Grizzly Creek fire. There's a fantastic Grizzly Creek Facebook page that really anyone in the valley may want to, you know, plug into, purely because they're putting out tremendous updates around it. And you're right, this is really unpredictable. So thank you for that, Joe. With that, I'm going to move to Pitkin County Emergency Manager Valerie McDonald with an update on fire restrictions.
Thanks, everyone, for having me. I'm Valerie McDonald, Pitkin County Emergency Manager. I work for the Sheriff's Office. I'm here to give you an update on fire restrictions. I'll be brief. I know you're on this call to hear about COVID, but it's important you have this information so you can prepare. We know you're all aware of the high fire danger. You just heard about it, but if you go outside, there's smoke in the air. The entire valley or northwest Colorado, for that matter, is in high extreme fire danger. The Pine Gulch fire in Mesa County has burned 68,000 acres as of this morning, and the Grizzly Creek fire in Glenwood Canyon, you all were just talking about, is now 6,200 acres as of this morning. Pitkin County, as well as surrounding counties, including the U.S. Forest Service and BLM, have been in stage 1 fire restrictions since July 2nd. Tomorrow, the sheriff is placing the county under stage 2 fire restrictions. The big difference there is that it essentially prohibits all fires, whether you're in a developed campsite with a permanent fire pit, that is still forbidden, and smoking outside is not allowed. You have to be in a vehicle or in a building. This is due to the prolonged hot, dry, windy weather we've been experiencing. We're in severe drought. According to the National Weather Service, there's no relief in sight. You can find more information on fire restrictions at pitkinwildfire.com. It will give you a list of exactly what's allowed and what's not. You can also call your fire departments for a free wildfire risk assessment and advice on how to prepare. The sheriff and fire chiefs follow data to make this decision. It's scientific. We look at live fuel moisture data and the ERC's energy release components, how many BTUs. In layperson's term, simply means how intensely a fire will burn. We're also experiencing red flag warning days, again, hot, dry, windy, critical fire weather. It's very difficult to suppress a fire in these conditions, which is why these fires are growing so rapidly. The last thing we need right now with COVID is a wildfire. Resources are spread thin. Everything is more complicated with COVID, which this group especially knows, and everyone should use caution with wildfire. We're asking the public to do their part. Everyone needs an evacuation and sheltering plan. You need to make a plan in advance so you're ready to move quickly during a fast-moving wildfire. Make sure you sign up to receive emergency alerts at pickanalert.org. And most importantly, sit down with your family or friends and talk about your likely evacuation routes. What's your sheltering plan? You may be away from your home for an extended period. Pack an emergency bag in advance, with your important papers and other essential items such as your medications. What's your family communication plan if you and your family, a couple kids down valley, you're working up valley, situations like that? What's your pet plan? None of these things are difficult to do if you do it in advance. If you wait until the fire is bearing down on you, it's almost impossible to act quickly. There's a wealth of information at ready.gov/plan. Let's be safe and not sorry, everybody.
Fantastic, Valerie. Thank you, both you and Joe, to be here today. We figured this would be a good transition into Larissa Dandino, who is at the Pitkin County Public Health, who really wants to talk about air quality and even air quality in COVID, because we've been reading a lot of information about the two things. And so Larissa, I'm going to kick it over to you.
Good afternoon. My name is Larissa Dandino. I am with Pitkin County Public Health. I'm a COVID-19 program administrator. Valerie just shared some great information, so I wanted to kind of piggyback off of that and provide you with some information related to your health. And as she mentioned, with COVID, wildfire is the last thing that we need right now, but I do want to share with you some ways to protect yourself during these times. So wildfire smoke can irritate your lungs, cause inflammation, affect your immune system, and make you more prone to lung infections, including the SARS-CoV-2 virus. To protect yourself from the wildfire smoke that you may see on certain times of the day or different days is to reduce your exposure by limiting outdoor exercise when it's smoky. And if you do have to be outside, choosing those lower intensity activities. If you're able to and have access to, you can use a portable air cleaner in one or more rooms of your house. And avoid activities that could create more indoor or outdoor air pollution, such as frying foods, sweeping, vacuuming, and using any gas-powered appliances. I do want to note that masks will not protect you from wildfire smoke. They don't catch the small harmful particles in smoke that can harm your health. However, they are not harmful if you are wearing them. So I just want to make sure to remind you that please wear your mask when you are outdoors around other people within 6 feet, and of course in those mandatory mask zones. So another important thing to touch on is what are the differences between symptoms of COVID and smoke exposure. I know I have had a bit of a cough here and there when I step outside, and so knowing when to decipher symptoms from smoke exposure and COVID. So symptoms from smoke exposure and COVID could be a dry cough, a sore throat, or difficulty breathing. However, symptoms from COVID, but not related to smoke exposure, could be fever or chills, muscle or body aches, and diarrhea. However, if you have any questions or you're concerned about your symptoms and whether they're related to smoke exposure or COVID, we ask that you just please contact your healthcare provider so that they could then assess whether you need healthcare or testing. And that is it for me. I'll give it back to you, Tracy.
Great, Larissa. Very useful information. I appreciate that. All right, so I think we're moving over to Josh Vance, who's also Pitkin County Public Health. You've kind of become a staple here on our community meetings, Josh, so happy to see you today, and I'll move it over to you.
Great, thanks, Tracy. As Tracy mentioned, I'm the epidemiologist for Pitkin County in the COVID-19 response. And I just want to give a quick update on our county level data to give everyone some information on where we're at and what we're currently seeing. So to look at the national picture, for a while we were seeing an increase in cases and we spiked up in mid-July to late July. Since then, we began to see cases decline a bit nationally, but as of August 12th, we still reported 56,307 cases nationwide. So still a significant amount of cases. So while we're slightly decreasing from where we were, we're still on average seeing a significant amount of cases. This is the number of deaths per day nationwide. And so again, you'll notice that we were declining in the number of deaths from about early April or mid-April down through end of June. And then since end of June, we began to see an increase in number of deaths that have been reported nationwide. And actually, on August 12th, just yesterday, we recorded the most or the highest daily death toll since June 25th at 1,497 deaths. So while it may not be making the news as much, this is still impacting a lot of people. People are still being hospitalized. People are still dying from COVID-19, and we're still seeing those numbers increase. This is Colorado State. Again, you'll notice a similar trend where we saw a spike in cases in April and then another spike in late July. We began to see a decline in cases across the state of Colorado. On August 12th, we reported 215 cases across the entire state. Looking at our neighbors, Garfield and Eagle County, they have seen a similar trend as the national picture and state picture has shown us. Garfield County, since the 10th, August 10th, has reported 1 case, and Eagle County, since the 10th, has also reported 1 case. And this is our picture here in Pitkin County. So we have not reported a new case in the past 5 days. that is in line with what we're seeing nationally and statewide. I don't want this to, I don't want to make any assumptions about this data showing that we're not seeing any cases, meaning that we need to, we should be complacent or we should, begin to really loosen any sort of restrictions. I think nationally we're seeing some states have begun to see a decline, so we're not seeing as many cases come from other states and other areas. And so I think that's partly contributing to our decline in cases. We've also had a statewide mask mandate in place for about a month now, and we've also tightened up some restrictions in the Roaring Fork Valley as well. So I think it's a combination of factors that we're seeing and have been contributing to our reduction in case counts. COVID is still here. We know we still have it in the community. We still make phone calls. We still receive reports of individuals who have been exposed to COVID-19. So we know that the virus is definitely still here, even though we haven't seen cases in a few days. So I just want to make that clear that just because we haven't seen those cases in the past few days, we know the virus is still here in the valley, and we need to still continue to take those safeguards. As far as symptoms, I want to display this to the community. These are the symptoms that have been reported by all of our cases in Pitkin County since July 1st. So you notice there's a wide array of symptoms that people experience, and we know this with COVID that people can experience many different symptoms, or really none at all, or very mild symptoms. But the most common symptom that we've had reported in our cases is cough. So half of our cases have reported a cough, followed by fever, muscle aches, and headache. You'll notice that loss of taste and smell are experienced by about a quarter of our cases, followed by just a myriad of other symptoms that some individuals have experienced. In our cases since July 1st, only 3% have presented or admitted to having no symptoms. And what we found is that when we've initially interviewed a few individuals, they have reported no symptoms, but when we've done follow-ups with them, they've later on developed some symptoms. This doesn't mean that individuals can't be asymptomatic while having COVID. We know that that is definitely possible. But what we're finding here in Pitkin County is that most of our cases do have symptoms, and most of them are not presenting asymptomatically, or there may be some individuals who just aren't being tested, and so we don't have their symptom data. But I did want to display this to show what the most common symptoms that we've seen are currently. This could change, but this is our current picture of symptoms. And then the last thing I want to talk about is exposure source. So this is where people are being exposed to COVID-19. And so the biggest slice of the pie here that you'll see is community spread. Community spread means that somebody was exposed to an unknown person who had COVID, meaning they don't know how they were exposed. So about a third of the individuals we talk to, they don't know where they were exposed to COVID. And we see this nationwide as well, as there's pretty high levels of community spread, but this is an indicator that we like to pay close attention to, because if we have community spread, it means that there may be other cases out in the community that we're missing or that we're not aware of. Community spread can also be tied to individuals that travel through and that are exposed to someone that was traveling, and then we may not hear about that case. But we do have significantly high community spread, but this is consistent with what Garfield and Eagle County are seeing as well. They're both experiencing about 40 to 50% community spread. So this isn't that surprising. The next biggest pie slice is household. We know that COVID likes to infect family members pretty easily because they're living in that same close quarter together. And so we're seeing about 28% of our cases are infected by a household member. And then there's a whole bunch of other slices on here where other people are being infected. Informal gatherings are another significant one and the next biggest one, and that's 8%. So dinner parties, places in which individuals are gathering together with close friends, that's another significant source of exposure. And so we want to remind the community that, even if you're with friends or family, some people can present asymptomatically. They may not know they have COVID, but they may be able to infect you, even though they're asymptomatic. So, we have limited informal gatherings to 10 individuals, but, really the recommendation is to really stay to yourself, stay home, stay with your family members as much as possible while we're battling this pandemic, because we just don't know at this point who has COVID and who doesn't. And, you know, the risk is there, right? Even if you're with close friends. So that's what this data is showing. Again, there's a lot of different ways in which people can be infected, but those are our main sources. And then really the last thing I wanted to talk about, which I touched on briefly, I believe last week, is these long-term impacts that we're seeing from COVID-19. And the last time I spoke, we talked about some heart damage that individuals with COVID may be experiencing. Some more recent studies, one from the CDC and one from Italy, have shown that a significant number of individuals who have had COVID-19 are experiencing chronic fatigue. So a study that was done by the CDC, it was a telephone survey that they did on a random sample of people that had been infected with SARS-CoV-2. They found that 37% of individuals had not returned to their usual state of health at an interview that occurred 2 to 3 weeks after they were tested. 71% of those individuals reported fatigue, 61% reported continued cough, and 61% reported headache or muscle aches. And then in the study in Italy, they did a 60-day post-diagnosis follow-up, and their results were actually more significant than what the CDC found. This hospital in Italy found that 53% of those that they followed up with had chronic fatigue, 43% were reporting labored breathing, 27% had joint pain, and 22% were reporting chest pain. So we know that while SARS-CoV-2 can be a significant virus in the acute phase, we're now finding a lot more data that's showing that in the long term, it could have some pretty serious impacts on people's health. And so while we're considering and looking at our data and we're seeing our case counts decline, we have to keep in mind that for each case we have, we don't know what the impacts could be long term for that individual. And so we want to continue to keep that in mind as we go about our business and as we continue to monitor the data that this disease is really more impactful than we once understood, and it's really having long-term effects on people. That's all I have. I'm going to pass the presentation over to Dave Ressler at AVH.
Thanks, Josh, and good afternoon, everybody. I'm always pleased to have the opportunity to talk to the community about what's going on at the hospital related to COVID. So, Josh, let's go to the next slide and start with a community resource for information that we're very impressed with the public health for having developed, and we think this really represents an excellent opportunity for anybody interested in understanding what our community's status is with regard to COVID. We suggest highly that you go to the Pitkin County website and to COVID stats, and then look at this coronameter, which has been recently launched. It is not just the graphic itself, but it has depth. You can scroll down through all of the contributing components of the determination as to where the community stands. As you can see, we're on the edge of concerned from cautious right now, and there are a number of contributing factors to that you can explore on the website and understand better. But I'm going to talk next slide today specifically about Aspen Valley Hospital and our as one of the contributors to that coronameter. And so, as we reported the last time we talked 2 weeks ago, at that time we had just moved from cautious to comfortable in that second category, average daily visits. And we are remaining comfortable as of now because all of our levels of activity, as reflected in the column to the left of the green indicators, are remaining below those or within those threshold levels. The area, so I'm going to go through each of those in a little bit more detail now. So let's go to the next slide, Josh. This is our admitted patients, the first of those three categories. The orange line right by my cursor, or Josh's cursor, is the limit. That is the threshold that we want to remain below. And as you can see, we've done that pretty comfortably. And as a matter of fact, for the past couple of weeks, we have not had a COVID-related admission. So we are very pleased that we are not having to put patients into the hospital. And we would reflect on here if we had to transfer somebody out. So this is those patients in total that require hospitalization for their condition. Next slide starts getting into that middle category of daily visits, and this starts with our emergency department. And you can see that we did have that, we did start experiencing and have been experiencing more visits to the emergency department with COVID-like symptoms beginning in early June. And we had that spike, if you will, around July 4th weekend, with a few days surpassing the 6 per day limit, but generally on a 14-day average remaining below that. And you can see for the past few days, we've had 1 to 3 patients, past couple of weeks, I should say, patients encountering at the emergency department. So that's good news as well. And then the next slide will address our Respiratory Evaluation Center. As a reminder, this is where patients with COVID symptoms are referred by their primary care physician for help with managing their symptoms. It used to be a tent, and it is now in our old emergency department that has not yet been renovated. So you can see the activity levels there are also remaining below the 10 per day threshold level, and really have been pretty consistent, though, over the past number of weeks, going back to mid-June or so. And next is our community testing. This is where we have our individuals with symptoms, or called symptomatic, referred for a test to find out if they have the COVID virus. And you can see this is actually what caused us to be cautious a few weeks ago around the July 4th weekend. And you can see where we were experiencing those levels that over a 14-day period were exceeding our threshold level. But for the 14-day average presently is below that. And so we remain comfortable. However, we remain very close. We're seeing generally 12, 14 patients a day. We're open weekends as well. If we get to 16 consistently over 14 days, we'll have to go back to cautious. But for now, we're holding our own, but not by much. Okay, the next and final, pardon me, a couple of comments about testing. I just took a couple screenshots right off that Pitkin County website that you may be looking at. Hopefully you are. This is an overall indicator of the amount of tests that we've done since the beginning. We've had 174 positive tests. That's a positivity rate of 6.8% overall from the beginning when we first started testing. We tested over 2,500 people. Next slide is a really helpful tool for you to look at. If you hold your cursor over any of the bars representing a week of activity in testing, you'll be able to see the number of positives, the number of negatives, and importantly, the percentage of positivity for that 14-day period, or for the most recent 14-day period. You can see that the high water mark for that positivity rate was that week of July 12th, when we had 9.5% positive, which is very close to the 10% level we're trying to stay below. We had 28 positive tests, and that was the high water mark in terms of positivity and also positive tests. You can see that since then we've been doing a continued amount of testing, high level of testing, but we have not realized that high level of positivity. In fact, on ending last week on August 9th, we're back down to 7.4% positivity, which we're pleased to see. Okay. Finally, our final slide is with respect to the number of employees that we have out ill. The slide or the graph continues to reflect, you can see we want to be below 6 critical staff, and yet we're reporting all staff that have COVID-like symptoms. So in other words, we're overstating the concern in this bar because we haven't yet gone to the trouble necessarily to identify the staff that are out ill with symptoms if they'd be considered critical. What does critical mean to us? It's a determination that our clinical leadership makes as to whether or not they're in a position that would hamper our ability to take care of COVID patients if they were not able to be performing their duties, like in the emergency department, critical care department, patient care unit, laboratory, et cetera. So we're still comfortable there. So overall, the hospital is comfortable and we're pleased with the fact that we never saw that spike, and I'd just like to thank the community for that, for sticking with your preventive measures and your 5 commitments to containment. So I'm now going to turn over, next slide, Josh, to Dr. Catherine Bernard, who is our one of our emergency department physicians, and you've seen her before. She's also our chief of staff. She's the head of the president of our hospital medical staff, for our physicians. So Dr. Bernard.
Hey, thanks, Dave, for that introduction. And, you know, I think Dave and Josh have really said the majority of what I think should be said. You know, AVH is comfortable and stable. As Dave said, we're decreasing in most of our indicators, in fact, barring that mildly symptomatic community testing. And of course, AVH and the Tri-County region are looking into ways to increase testing capacity, given the fact that we all expect it to increase in the coming months. But I think we need to be clear, we're decreasing, but it has not disappeared. We are still seeing cases. I am an ER physician, and I see 1 patient to 3 patients per day in the ED. Still, the majority of them are not terribly ill. We haven't admitted or transferred out a patient in a couple of weeks. That's great news. And I do believe it's due to the fact that all of us are doing our part to decrease viral transmission, but the virus is still there. So we cannot let down our guard. We do need to continue doing the things that we can to decrease viral transmission rates. That said, AVH is comfortable and stable. And what does that really mean? I mean, that means if you should be so unlucky to need my professional help emergently, the team is ready. We're prepared. We're available to help you if you have a heart attack, a stroke, a trauma. And all of Pitkin County is ready to deal with the incidents that they're involved in to help keep us all safe. So, gosh, thank you all, you know, for your continued efforts. It's really these combined efforts that allow us to continue to move forward together. So thanks again. That's all I have.
Great. Thank you, Dr. Bernard and Dave, both for being here. We're going to move it over now to Justine Seeley of the Pitkin County Public Health Team. And she's really going to dive a little deeper into the chronometer that Dave shared, because we're really hoping this is going to be a great tool for the community.
Thank you, Tracy. As Dave and Tracy already mentioned, this is our new chronometer, and you may have seen it online. We're very excited to get this out. A lot of work went into this with a lot of different people, so thank you for everybody that contributed to it. So if you do go to our website, it's on the COVID-19.pitkincounty.com, and you click on chronometer, you will be brought to a page with this gauge on it. And we really just wanted to give the community a visual representation of where we are currently and where we might be heading as it relates to COVID-19 and the measures that are in place. So at the top of the page is this gauge. On the leftmost side is protect our neighbors. So that would align with what the state has proposed for the next phase. And if we were to get down there, the needle on the gauge would be all the way to the left. And then on the other side is stay at home. So back to where we were when the pandemic first started. And if the risk gets that high, the needle would be all the way to the right. Right now, we are in the cautious phase, on the verge of concerned. And that is based on a few different key indicators that I will go into detail on in a second. So there are 4 levels, and we base this on the resolve to save lives measures as well as the protect our neighbors measures. So within each level, there's a thresholds for the data points that we're looking at, which would put us into different levels. So all of these are located on the web page, and if you click on the drop downs, you'll see all of the measures that would be in place for each level. Some of the measures are mandatory when switching between levels, which include mask use, event and group sizes, and visitors. But some of the sector-specific changes will vary based on the data we're seeing. So for example, if we were to move into level 3 concerns, that doesn't necessarily mean that all restaurants and businesses will have to close immediately. It's based on what we're seeing in the data, so the changes will vary case to case. The key indicators that we're looking at fall into 3 categories. One of them is disease spread, and this is really showing what the transmission is like in our community, and that could be due to visitors in the county or also our surrounding counties. So right now we're at a very high risk, and the indicators, the metrics that we're looking at are the number of new cases per day in a 14-day period, the percent of out of jurisdiction cases. So this would be the number of people who test positive in our county but don't necessarily live here, so they're not getting included in our case counts that you would see on the state website. The percent of community spread, so people, the cases that they don't know where they were infected or they don't know if they were in contact with someone who tested positive. And then also the number of new cases per 14-day period in Garfield and Eagle counties. And we are working on some of this data is on our current dashboard right now on the web page, and we're also working with Garfield and Eagle County to put together some regional indicators and making sure that our thresholds match up with Garfield and Eagle, since there is so much travel and sharing of contacts between the counties. The next one is hospital system capacity, which Aspen Valley Hospital had already touched on. And as they said, we are in a comfortable situation right now. And the metrics that we're looking at are inpatient hospitalization capacity, average daily visits to the emergency department, respiratory tent, and community testing, and the number of essential healthcare workers out with COVID-19. And this one is important for us to look at when thinking about our alert levels, because it's an indicator of how well our hospital is ready to deal with the surge in cases, and also if they can keep up with the regular non-COVID healthcare issues as well. And the last one is disease control. And this one is how well we are able to use the box-it-in strategies and our capacity to contain and quarantine and isolate cases as they come up. So the metrics that we're looking at here are the PCR testing positivity rate, the percent of cases interviewed within 24 hours, the percent of contacts traced in 48 hours, the number of days from symptom onset to getting tested, and the test turnaround time in days. So all of these key indicators that I mentioned, these are updated daily, and we're working on updating our website as well to include some of these, the graphs and figures that relate to each of the metrics on the web page. So you'll be able to see where we are, which level we're at, which measures are in place, and then all of the data that is contributing to our current level, all on one page on our website. And the meter itself, we will be updating that weekly and on an as-needed basis, looking at all of the quantitative data that I just mentioned, but also looking at some of the qualitative things that you can't really objectively measure. So how, like our capacity to respond to certain things, and that there's just a couple internal measures that we'll be looking at that will contribute to which levels that we are in. We'll pass it on to Jordana, and she'll talk about some of the current measures that are in place right now.
Thanks, Justine. My name is Jordana Sabella. I'm with Pitkin County Public Health as well. And I wanted to give everyone an update on the current status of the public health order. So the public health order that is in place right now expires tomorrow on August 14th, and that will be extended through September 30th. So some of the, you can just stick on this slide, thanks Justine, some of the points I wanted to really highlight that are included in this current order that will be with us for a while going forward are that facial coverings are required indoors if it's a space open to the public, and outdoors if you're at risk of being within 6 feet of someone else who's not a part of your household. I think we've all gotten pretty used to that requirement. We can also talk through the fact that the informal group size is limited to 10. So Josh mentioned this, and while that informal gathering group size is permitted up to 10, we're still encouraging everyone to be spending time as much as possible just with household members, and then decreasing those social interactions that you're having overall. And that really goes to all of the points where how Justine mentioned what level of caution we're in with the corona meter. Those are some of the measures that we can all personally take. For a group size of 11 to 50, those are currently permitted, but they need an event safety plan and a designated event coordinator, someone whose job it really is going to be responsible for making sure all of the measures in the event safety plan are followed. So more information about that is also available on the website. And there's a flow chart depending on whether you need a permit, whether the event is being held in a restaurant or kind of business space, or in a private event, or if it's a performing arts kind of event. So that's all available on the website. The other measure I really wanted to highlight here is that visitors are required to be symptom-free for 10 days before coming to Pitkin County. So to know that if you are here, if you have visitors coming in to visit you, if you work as a realtor or in the hotel or any of the other industries, we're really asking, or we're requiring that visitors know that they need to be symptom-free before coming to visit Pitkin County for us to be able to continue to drive down the transmission of COVID in the community. The caveat that we always have with any of our public health orders is that if the data changes, those indicators that we're looking at daily change, there's always the possibility that the public health order can be changed before September 30th in order to address what we're seeing. And that the overarching goal with this public health order and all of the work that we're doing in the public health department right now is to continue to drive down disease transmission. We're looking at really focusing on driving this down before Labor Day, continuing to work towards getting schools back in session, and we'll echo the comments of appreciating all of the work that the community is doing in sticking to those 5 commitments and working towards this together. And with that, I'm going to pass it along to Bob Schultz, our business liaison, to talk through some new guidances that have been developed.
Good afternoon, and I'll be talking about carpools, taxis, limos, shuttles, and rideshares. Starting with carpooling, Pitkin County has been encouraging carpooling for decades and rewarding those who do so, and we're in the unusual position at this moment of discouraging carpooling. But don't worry, we'll be back encouraging it again in the future. But for now, it is one of the sources you saw on Josh's pie chart, but also when you look at the valley-wide, the other 2 counties that are involved in our transportation shed, then you see it's a bigger issue than just the Pitkin County portion. So we are offering recommendations. This is not guidance in the same sense as the things that Jordana just went over, where they are enforced through our public health order. These are what we're asking people to do. We sent out some drafts, and we heard back from some, particularly hotel shuttles and the taxi company, that, hey, can we get a first chance at doing this through recommendations before we go through another process that involves a business safety plan. So we are going to, in fact, try that, and hopefully we'll get enough folks that are complying that we won't need to make them into guidelines. So if you are a part of a carpool, if there are 6 seat belts in that car, we're encouraging you to have no more than 3 people in the carpool. We are encouraging everyone in the vehicle to be wearing face coverings, and the better the mask, the safer the ride. When the weather allows, we would really encourage you to have the windows open. Fresh air is one of the ways to dissipate the threat of the virus transferring by air. The virus transferring by droplets, you can wash your hands before you leave for work and wash your hands when you get to work. And then the driver, the owner of the vehicle, can have a package of those disinfectant wipes in their car and just give the high touch areas a quick wipe down before and after they carpool. All of those things together will make a safer carpooling experience for those of you who want to maintain carpooling during this period of time. Next slide. And also on the more visitor-oriented side of this, taxis, limos, and rideshares, similar recommendations, keeping the passenger seat open so that the driver has a little bit of additional space. Wearing face coverings just in general is, when you're around other people, is going to be something that's always recommended. The same occupancy restriction, why is that? Well, we're trying to create a little bit of extra distance, and we're trying to have fewer people talking or coughing or sneezing into the space. So there's the reason for the occupancy restrictions. If you are in the limo or taxi or hotel shuttle, either encouraging the passengers to load their own equipment or luggage into the vehicle, or providing hand sanitizer so that if your employee or you are the employee is loading the stuff for people other than themselves, they have a chance to clean their hands afterwards. And then again, same thing, disinfecting high-touch areas, so door handles, places on it that people would be grabbing when they're loading into the vehicle. Those can be frequently disinfected just to keep that viral load down. A final piece of this is that if we do start to see increased problems from transportation, then we'll have to circle back and look at making this guidance instead of recommendations. But for now, we want to try it as a recommendation. Looking forward to the winter and the things that we'll be spending time looking at. Indoor spaces are going to be a significant area of concern for the winter. So the entire team will be looking at ways to look at what can be done to make indoor spaces as safe as reasonable over the course of the winter, since all of us will be spending less time outdoors and more time indoors. So that's a little heads up for things that you might see in the future, and we'll be working with our community and business partners to look at what possible guidance changes would happen as we think about winter season. That's it for me.
Great, thank you, Bob. I believe I've touched everybody. Did I miss anybody? I don't think so. So great job today, chock full of information. For the community who joined us, we appreciate that you're here. We do plan to be back with you on Thursday, August 27th, and that's again from 1 to 2. Our goal and our plan is really try to get our partners with the school districts to potentially join us, because we know there's a lot of eyes on that coming next for everyone, and they've been working around the clock to put their plans together, but we're hoping to get them here at our community meeting as well. So with that said, we're signing off. Everyone be well and be safe, and we'll see you soon.
Thanks, Tracy. Great job.
Yeah, you guys too. Thanks for